Hi, everyone, and thank you for joining our video about strengthening family engagement, a multi-system approach in Massachusetts. Next slide. This is for the 2021 OSEP Leadership and Project Directors Conference. Next slide. And we three will be presenting today. We're all from the Federation for Children with Special Needs in Massachusetts. And we have Pat Cameron, who is the Director of Family Ties, Pat Nemia, our Director of Mass Family Voices and our F2F, and me, Cambria Dodd-Russell, the Project Director for the Massachusetts Statewide Family Engagement Center. And today we hope that we'll be able to accomplish these three things. We're going to talk about family engagement across systems in Massachusetts, the impact on families, and finally, we'll give you some examples from the field. So let's just start off with a basic definition that we can all agree upon for family engagement. And this one is from the U.S. Department of Education and the Department of Health and Human Services. And it says, family engagement refers to the systematic inclusion of families and activities and programs that promote children's development, learning, and wellness, including in the planning, development, and evaluation of such activities, programs, and systems. So this is the definition that we're using. My dog agrees with it. Go ahead to the next slide. So why do we care about family engagement? So here are a few of the reasons. We know that family engagement, and when I say that, I mean meaningful family engagement, can have an impact on a child's social emotional development, on their physical health, their readiness for school, their academic achievement in the school arena. That includes attendance and grades, and also likelihood to graduate, all being better when there's meaningful family engagement, and generally having an impact on success in life for kids. Effective and meaningful family engagements also associated with a reduction in the number of children entering the child welfare system. And in the healthcare arena, it's associated with better patient safety, increased health outcomes, and that's actually for not just the child, but also the family, and better patient experiences. So there's a lot of good reasons we should be investing in and thinking a lot about family engagement. And go to the next slide. And because we have all of those great outcomes that come from family engagement, and I would add not only just for our kids, but for families, for professionals, and also for institutions like schools and hospitals. In Massachusetts, we have been looking at trying to work across systems for family engagement. And we've been doing this for multiple years, working together in family engagement coalitions across the state. And we're doing this in order to come up with some common principles that everyone can agree upon around family engagement, and also common language. And we're really looking for families to have a more consistent experience as they encounter different systems, so that they'll have a similar family engagement experience when they're working with a school, when they're working with the Department of Mental Health, when they're working with a child care provider, an EI provider, or with a hospital. Can you go to the next slide? So the way that we have been trying to create this multi-system approach is through the development of this framework. It's a framework for prenatal through young adulthood family engagement in Massachusetts, and you can actually find the full document on the website for the Massachusetts Statewide Family Engagement Center. And this was developed through regional coalitions where around 500 people were getting together in smaller groups over a period of 2 years, really thinking deeply about what everyone could agree that they believe about family engagement and what priorities should be around family engagement. And this work was led by our state education department, the Early Education and Care Agency for the state, and also the Department of Public Health. It also included people from other state agencies. We also had school district representation, family representation, librarians, after school providers, and pediatricians. So people from lots of different sectors involved in deciding what it is we as a state believe about family engagement and what we think is important. Can you go to the next slide? So ultimately, our coalitions came together around these 4 ideas. And so we have agreement among 11 state agencies that the 4 key elements of family engagement in Massachusetts are to build trusting relationships between professionals and families, to acknowledge and support family health and well-being, to foster and value diverse ways of engaging or meet families where they are, and finally, to partner to support student growth, learning, and well-being. So we right now are at the point where we have agreement across the geography of the state and across these different systems that these are the key elements of family engagement that are all agreed upon. Go ahead.
So I'm going to talk a little bit first about kind of where we have been on family engagement and that inspired this work and has us moving, and the reasons it has us moving in a different direction. And so it's what we refer to as the silo system of family engagement. And it works, it works. What happens is the work that's being done is done in individual silos or individual systems. And it does, this family engagement within an individual silo system does recognize and support the family needs, but it does it just in a smaller kind of sliver of what the family needs. And it doesn't engage the other systems. And so I really like this graphic because it shows that we have all of these wonderful systems for families. But if you look at them, there's no window, there's no door, there's no ability to move information back and forth. And so what this makes me think about is the family, and each silo itself may have a wonderful system in which they engage the family, but the family's standing outside in this field and they have to, first go to community and then education, maybe back to community to let them know what happened, and then on to finance and health. And so there's a lot of work placed on the part of the family. And for the people engaging them, the question is, do you really know who you are engaging, or do you just know this one part of a person? And so is it really meaningful family engagement? And we can look at it in another way and asking ourselves if we're engaging families effectively through kind of this silo systems approach. If we look at this graphic, that is actually referred to as the care map, and it was developed, this one in particular was developed by a woman named Kristen Lind, who many years ago worked at the Federation for Children with Special Needs, and there's some information about her at the bottom. But I think it shows again, so this is a family, and Kristen did this, she put herself and her child in the center, and then all of the things that they are navigating around her. And so it's a really good graphic when you're trying to explain to somebody what a family's trying to accomplish. But I think, and so she used it many times for providers, but I think it also, we can look at it, if you look at this, it's interesting that it's really the family out as having the responsibility for engagement, information, navigation. And we're not sure if it's inward, but the thing that's definitely missing is any kind of connection among the systems. And so, while this is a really good graphic of what the systems her child needed to engage in, I think it also highlights how by individually engaging, each system engaging a family, I think it highlights how the family in the center, it can be a very lonely, it can be very isolating and a very frustrating experience. So the question, are we engaging families effectively in a silo system? And I think this shows that no, we're probably not.
So when we think about using a multi-system approach, instead of silos, think of gears. and how each gear relies on another to keep turning, to keep functioning, and to continue its services. And so instead of those silos, as Pat had talked about, let's open up those doors, let's get some windows in there, and let's really look at this differently. And, when we think about how a clock works and all of the gears that it takes to wind a clock to keep accurate time, one gear relies upon another. And when we think about family engagement from this sort of balcony view, we think about what it takes for each one of those agencies to interact with one another, to have that same common definition that we started describing at the beginning of this presentation, and to really have a common understanding and respect and value to what families bring to the table. And so when we think about the relationships that we have with each individual family, how do they interact? How do they create those gears and that interaction with each one of the entities that was in that care map? How is health integrating with education? How is community, integrating with family life, and so forth? So we really want to understand what each one, how it relates to one another, how it can really strengthen. I mean, if you think of that intertwining and strengthening programs, really from a silo to a gear brings a whole new definition. Next slide, please. So when we think larger than that, larger than just a few entities or a few departments, and we think more systemically across the state, then we really, really have the potential for a well-oiled machine. And when you think about fully engaging families and what that means across systems, really strengthens the whole machine. And when you look at those individual gears, oftentimes when one slows down, it could have the potential of slowing the whole system down, unless it's built in so that there's some compensation, that one will increase its participation so that it picks up where another is slowed down. And we're interrelated. And so we can rely on each other to really help. And that's what's happening here in Massachusetts. And so when we think about, how we can strengthen our own system, and it's no longer territorial, it's really participatory, it's collaborative. And because we've got this from the family engagement perspective, we're also branching out into other areas within our collaboration as well. And we are just working so well together here in Massachusetts. Next slide. So we really want to take this opportunity. We're going to stop sharing our slides and just have a conversation about examples from the field. And I'm very happy to start us off with what has been happening at the Federation. And we are the lead agency for the Massachusetts Family Engagement system, and we collaborate with all of the state agencies, as Cambria so nicely described. But what we've begun to do within our agency, within cross projects, as many agencies have their own individual project silos, we have been so intentional about breaking down those silos so that we have the opportunity to think and respect that time when somebody says, well, what about families? What are we doing around family engagement? And, and having those reminders ever present, because it takes that to really change the opportunities and change a pattern of behavior by practicing it over and over and over again. So oftentimes at staff meetings, we're bringing up Jamboards and we're talking about how we can engage families, do our work in a meaningful and intentional way for family engagement. And we do it between our projects and we do it across the whole agency. And everyone is now participating. And it has become a very successful opportunity.
So I wanted to talk a little bit about kind of the direction that we're going. And And before I do that, though, I just want to mention that like this particular presentation is an example of where we're headed in terms of breaking down the silos within our own organization. So we have 3 different projects that don't necessarily have to work together, but we're using family engagement as like the glue or the binder to bring us all together. So this is just one of the many examples of what we're doing internally. So looking long term, what we really want to see in Massachusetts is that these different agencies and different systems and organizations actually are speaking to each other. That when a family has an issue, a struggle, or a success, that doesn't happen and is only known in one area or in one of the silos that Pat was talking about. That instead the family will be able to have information shared between the different agencies, and the approaches will be consistent between different agencies so that they have a lot of the burden, I guess, taken off of them when we're all kind of on the same page from the beginning about what it means to really partner with families. Because what we have right now, as Pat said, is that as a parent, I have to partner with the school, I have to partner with the Department of Mental Health, I have to partner with my pediatrician. But if we can bring those institutions together to all work for my family in collaboration, then we have a much stronger machine. And so we're looking forward to a time where that's the norm instead of these bright spots that we're going to share with you today, as we're hoping and I'm confident that it'll happen because we have these 11 state agencies that are on board with really prioritizing family engagement. We have people from the state agencies and from school districts and from communities and community-based organizations coming together to talk about family engagement, going through trainings on the frameworks that we're hosting, and making their own plans for how to make this work in their particular community. So I think we're in a really hopeful space in Massachusetts, and we have a really nice example that Pat is going to share with us about how this is working in practice right now.
I have had the opportunity to work in a committee or an initiative that was developed in the state, and it was brought together by a number of pediatrician leaders within the state, and specifically those that work with do a lot of work around our mass Medicaid or mass health. And so they were working on our next application and wanted to help inform the state about things that kids would need in our next application to the federal government about monies for maybe special projects or programs. But it was interesting. But in doing that, they're thinking, well, do we just need pediatricians at the table? Because we can come together and say, this is what we do for kids, and this is how much we should be paid. And we'll tell the parents about it when they come in for a visit. But do they really know? And so I think this group of pediatricians was really insightful in the fact that they said, okay, no, we need to bring together also some state agencies. So Mass Health was there, but also we need some support from other state agencies to understand some of the workings of the state. And we need our professional partners. We need people, all the people that are involved with kids. So we need representatives from the mental health professional partners. We need organizations that are involved in healthcare, the education system, the social systems like housing and food. And so they brought all of those groups together. And then importantly, they were very thoughtful, and they brought families and family representation to the table, which I was happy to participate in. And I think we worked for a year to put together a white paper that then we sent, to the leaders at Mass Health. But one of the things I think that was so interesting was that for pediatricians or for stakeholders who are so invested in helping families, for many of them, maybe it was the first time that they really listened to what families said they needed. And it was a really good opportunity then for families to have multiple systems in a room to be able to say to the providers or the pediatricians and the school systems, so what would work better if the two of you would work together? This would make things much, much better for families it would probably help the health of the child and the education outcomes of the child. And so therefore, what we're asking for is going to be meaningful and impactful to families. So I think this group that was brought together is just a really good example of meaningful family engagement, and listening and understanding the entire person or the entire family that you were trying to engage. So that is the end of our presentation. Thank you very much for joining us today. We hope you have a wonderful time at the conference. We hear that there are going to be wonderful presentations, networking opportunities. You can reach out to any of us at the Federation for Children if you have any questions. So thank you, everybody.
Thanks for
Thank
joining
you all.
us.
Bye.